Hello, my name is Dr. Gregory Hanker. I am an orthopedic hand surgeon at the Southern California Orthopedic Institute, and for the past 27 years I have been specializing in the treatment of the broken arm, resulting from traumatic fractures that affect the elbow, wrist, and hand. Today, I'll be discussing the orthopedic care of these broken bones. So, what is a fracture? Well, simply stated, a fracture is a broken bone. A fracture occurs when enough force is applied to the bone to break it. When this happens, there's pain, swelling, and decreased use of the injured part, finger, hand, or wrist. The fracture may be simple, with the broken bone pieces stable and normally aligned, or complex, with multiple unstable pieces that are misaligned and displaced. Fractures often take place in the numerous bones that constitute the hand and wrist: metacarpals, phalanges. The fractured finger is usually painful, stiff, swollen, and often discolored. There is loss of movement, and the finger may appear crooked or deformed. In some instances, the finger may actually appear normal, or there will be minimal symptoms, but a serious break in the bones can still be present. A fracture that occurs within a joint may seriously affect the joint surface, causing degeneration of the cartilage coating of the bone. This leads to post-traumatic arthritis in the knuckle. In the wrist, the most commonly broken bone is the end of the radius, the distal radius, but other fractures in the 8 carpal bones can occur, especially in the scaphoid bone. Falling down onto your outstretched hand can lead to these wrist fractures. The wrist will be stiff, swollen, painful. It may or may not appear deformed. There may also be associated injuries to the soft tissues about the wrist joint, such as ligaments, tendons, and even the nerves. Examination and x-rays are needed to tell if a fracture has occurred in the hand or wrist. In some injuries, an MRI scan will be required, especially if there is an associated soft tissue component with the break in the bone. Treatment is totally dependent on many factors: the specific type of break, its location, the patient's age and activity level, hand dominance, occupation, and avocational activities, prior injuries, and basically the overall health status of the patient. Certain fractures are simple and in good position, with the bone and joints well aligned, whereas others are fragmented into multiple pieces and may be badly displaced. Some fractures are stable and will stay in place, where others are unstable and might shift during treatment. A splint or cast may be used to treat a fracture that is both stable and non-displaced, or to protect a fracture that has been set or manipulated back into alignment. The protective device is then worn for several weeks as the fracture heals. Other fractures may need surgery to set the broken bone pieces and to stabilize the injury. This could require open surgery with the application of an implant, such as plates, screws, pins, or even an external fixation device. Sometimes arthroscopy is used to evaluate and treat these wrist injuries. In some severe fractures, bone grafting may be necessary to fill in any gaps. Recovery time varies considerably, depending upon the severity of the fracture and the associated injuries, and the general medical health of the injured patient. While the hand or wrist fracture is healing and there is enough stability, it is important to keep the other non-injured joints moving so as to prevent stiffness. Motion exercises should be started as soon as safely possible. Supervised hand therapy is often used to help recover flexibility, strength, and function. If the cartilaginous surface of the broken bone is badly injured, post-traumatic arthritis may develop. On occasion, additional treatment or further reconstructive surgery may be needed. It is therefore very important to seek care with an orthopedic surgeon with an in-depth understanding of the factors involved in the management of traumatic injuries to the hand and wrist in order to get optimal treatment and a favorable outcome.